Number 45. A 32-year-old man undergoes a distal pancreatectomy, splenectomy, and partial colectomy for a gunshot wound to the left upper quadrant of the abdomen. 1 week later, he develops a shaking chill in conjunction with a temperature spike of 39.4 degrees centigrade, 103 degree Fahrenheit. His blood pressure is 70 by 40 millimeters of mercury. Pulse is 140 beats per minute and respiratory rate is 45 breaths per minute. He is transferred to the ICU where he is intubated and a Swan-Ganz catheter is placed. Which of the following is consistent with the expected initial Swan-Ganz catheter readings? A. Decrease cardiac output. B. Decrease peripheral vascular resistance. C. Increase pulmonary artery pressure. D. Increase pulmonary capillary wedge pressure. And E. Increase central venous pressure. So the answer is B, decrease peripheral vascular resistance. Number 46. A 43-year-old trauma patient develops acute respiratory distress syndrome ARDS. After the positive end expiratory pressure PEEP is increased, the patient's oxygenation improves. What is the mechanism by which this occurs? Okay. A. Decreasing dead space ventilation. B. Decreasing the minute ventilation requirement. C. Increasing tidal volume. And D. Increasing functional residual capacity. E. Redistribution of lung water from the interstitial to the alveolar space. The answer is D. Increasing functional residual capacity. Number 47. A 27-year-old man was assaulted and stabbed on the left side of the chest between the areola and the sternum. He is hemodynamically unstable with jugular venous distension, distant heart sounds, and hypotension. Which of the following findings would be consistent with a diagnosis of hemodynamically significant cardiac tamponade? A. More than a 10 mm decrease in systolic blood pressure and expiration. B. Decrease CVP. Equalization of pressures across the four chambers on Swan-Ganz monitoring. And D. Increased respiratory variation of the inferior vena cava. E. Overfilling of the right atrium. So the answer is C. Equalization of pressures across the four chambers on Swan-Ganz monitoring. Number 48. A 55-year-old woman requires an abdominoperineal resection APR for rectal cancer. Which of the following clinical markers is most likely to predict a cardiac event during her non-cardiac surgery and should prompt further cardiac workup prior to her operation? A. Abnormal electrocardiogram. B. Prior stroke. C. Presence of an S3 gallop. D. Uncontrolled hypertension. And E. Her age. So the answer is C. Presence of an S3 gallop. 49. A 70 kg woman is to undergo nail removal from her right ring finger in the ambulatory surgery clinic. Which of the following is the most appropriate option for local anesthesia? A. Digital block with 1% lidocaine without epinephrine up to 4.5 mg per kg. B. Digital block with 1% lidocaine with epinephrine up to 4.5 mg per kg. C. Digital block with 1% lidocaine with epinephrine up to 7 mg per kg. D. Local injection around the nail bed with 1% lidocaine with epinephrine up to 4.5 mg per kg. And E. Local injection around the nail bed with 1% lidocaine with epinephrine up to 7 mg per kg per ml. The answer is A. A digital block with 1% lidocaine without epinephrine up to 4.5 mg per kg. Question number 50. A 22-year-old man sustains severe blunt trauma to the back. He notes that he cannot move his lower extremities. He is hypotensive and bradycardic. Which of the following is the best initial management of the patient? A. Administration of phenylephrine. B. Administration of dopamine. C. Administration of epinephrine. D. Restoration of intravascular volume. And E. Placement of a transcutaneous pacer. So the answer is D. Restoration of intravascular volume. Number 51. A 32-year-old woman is involved in a high-speed motor vehicle collision. She has been recovering from her injuries and is now ready for transfer to a rehab facility. Prior to transfer, the patient is sitting on her bed when the physician removes her right subclavian central line. Suddenly, the patient becomes tachycardic and hypotensive. What is the next best maneuver? A. Decompression of the right chest with a needle in the second intercostal space. B. Placement of a right chest tube. C. Emergent pericardiocentesis. D. Placement of the patient in a left lateral decubitus Trendelenburg position. And E. Bilateral clamshell thoracotomy with aortic cross clamping. The answer is D. Placement of the patient in a left lateral decubitus Trendelenburg position. Okay, 52. A 30-year-old man sustains a significant crush injury to bilateral lower extremities. In addition, he has altered mental status with a GCS of 6. The decision is made to perform a rapid sequence intubation. Which of the following agents should be avoided? A. Succinylcholine, B. Vecuronium, C. Pancuronium, D. Halothane, and E. Etomidate. So the answer is A. Succinylcholine. 53. An 18-year-old woman develops urticaria and wheezing after an injection of intravenous contrast for an abdominal CT scan. Her blood pressure is 120/60, heart rate is 155, and respiratory rate is 30 breaths per minute. Which of the following is the most appropriate immediate therapy? A. Intubation, B. Epinephrine, C. Beta blockers, D. Iodine, and E. Fluid challenge. The answer is B. Epinephrine. Number 54. A patient develops a fever during a blood transfusion. Prior to administration of the blood, the unit was checked and confirmed. Lab values reveal no evidence of hemolysis. Which of the following is the likely etiology? A. Viral presence in donor blood. B. Reaction against plasma proteins or IgA. C. Antibodies in donor blood to recipient white blood cells. D. Major blood incompatibility, ABO mismatch. And E. Recipient antibodies against white blood cells in the donor blood. The answer is E. Recipient antibodies against white blood cells in the donor blood. Number 55. A 72-year-old man with diabetes, renal insufficiency, and coronary artery disease presents in septic shock from emphysematous cholecystitis. His oxygen saturation is 100% on 6 liters of nasal cannula, and his hemoglobin is 7.2. His mixed venous oxygen saturation is 58%. Which of the following treatment options will improve his oxygen delivery the most? A. Increase in his inspired oxygen concentration. B. Transfer him to a hyperbaric chamber. C. Administer ferrous sulfate. D. Administer an erythropoietic agent. And E. Transfuse 2 units of packed red blood cells. The answer is E. Transfuse 2 units of packed red blood cells. 56. An obese 50-year-old woman undergoes a laparoscopic cholecystectomy. In the recovery room, she is found to be hypotensive and tachycardic. Her arterial blood gases reveal a pH of 7.29, oxygen 60, carbon dioxide 54. Which of the following is the most likely cause of this patient's problem? A. Acute pulmonary embolism. B. Carbon dioxide absorption from induced pneumoperitoneum. C. Alveolar hypoventilation. D. Pulmonary edema. And E. Atelectasis from a high diaphragm. The answer is C. Alveolar hypoventilation. Number 57. A 65-year-old man who had a 25-pound weight loss over the previous 6 months is diagnosed with adenocarcinoma of the distal esophagus. He undergoes a transhiatal esophagectomy complicated by a cervical leak. He is receiving enteral feeds through a jejunostomy tube. After a week, his physician wished to assess his nutritional resuscitation. Which of the following is the most accurate short-term measure of his nutritional status? A. Urinary nitrogen excretion level. B. Total serum protein level. C. Serum albumin level. D. Serum transferrin level. And E. Serum prealbumin level. So the answer is E. Serum prealbumin level. 58. A 63-year-old man with multiple rib fractures and a pulmonary contusion requires prolonged intubation. He is unable to be weaned from the ventilator and is on a volume control mode. He has a tracheostomy and a percutaneous gastrotomy in place through which he is being fed. The surgeon orders a respiratory quotient RQ, which is the ratio of the rate of carbon dioxide production over the rate of oxygen uptake. The RQ is 1. Based on this information, which of the following is the next step in his management? A. Decrease the inspired concentration of oxygen. B. Decrease the rate on the ventilator. C. Increase the rate on the ventilator. D. Decrease the carbohydrates in his enteral feeds. And E. Increase the total number of calories in his enteral feeds. So the answer is D. Decrease the carbohydrates in his enteral feeds. 59. A 22-year-old woman is involved in a major motor vehicle accident and receives a tracheostomy during her hospitalization. 5 days after placement of the tracheostomy, she has some minor bleeding around the tracheostomy site. Which of the following is the most appropriate immediate therapy? A. Removal of the tracheostomy at bedside. B. Exchange of the tracheostomy at bedside. C. Exchange the tracheostomy in the operating room. D. Bronchoscopic evaluation of the trachea at bedside. And E. Bronchoscopic evaluation of the trachea in the operating room. The answer is E. Bronchoscopic evaluation of the trachea in the operating room. 60. A 39-year-old woman with a known history of von Willebrand disease has a ventral hernia after a previous caesarean section and desires to undergo elective repair. Which of the following should be administered preoperatively? Number A, high purity factor 8 C concentrates, B, low molecular weight dextran, C, fresh frozen plasma, D, cryoprecipitate, and E, whole blood. The answer is D, cryoprecipitate. 61. You are the physician on call for the extracorporeal membrane oxygenation ECMO service. There are 5 calls today but only one machine and one technologist available. Which of the following patients is the most appropriate recipient of this service? A 1-day-old full-term anencephalic 4 kg boy suffering from meconium aspiration syndrome and hypoxia. B, a 75-year-old man with Alzheimer's disease, severe pneumonia, and elevated pulmonary arterial pressure. C, a neonate with a diagnosis of severe pulmonary hypoplasia who is in respiratory failure. D, a 5-year-old girl with rhabdomyosarcoma metastatic to the lungs. And E, a 3-day-old boy preoperative for a congenital diaphragmatic hernia. The answer is E, a 3-day-old boy preoperative for a congenital diaphragmatic hernia. 62. A 72-year-old man has multiple injuries and an altered sensorium after a high-speed motor vehicle collision. He is intubated for his decreased mental status. During intubation, a large amount of gastric contents are noted in the posterior pharynx and he aspirates. Which of the following is the appropriate initial treatment? A, bronchoscopy, B, steroids, C, prophylactic antibiotics, D, inhaled nitric oxide, and E, high positive end expiratory pressure. The answer is A, bronchoscopy. 63. A patient with severe neurological devastation after head trauma has a prolonged course in the intensive care unit. He has been mechanically ventilated for his entire hospital stay. Which of the following clinical findings is diagnostic of a ventilator-associated pneumonia? A, white blood cell count of greater than 12,000 ml. B, greater than 100,000 colony forming units per ml of an organism on bronchoalveolar lavage. C, greater than 100,000 colony forming units per ml of an organism on bronchoalveolar lavage. D, purulent tracheal secretions. And E, right lower lobe infiltrate on chest x-ray. The answer is C, greater than 100,000 colony forming units per ml of an organism on bronchoalveolar lavage. 64. Shortly after the administration of an inhalational anesthetic and succinylcholine for intubation prior to an elective inguinal hernia repair in a 10-year-old boy, he becomes markedly febrile, displays a tachycardia of 160, and his urine changes color to a dark red. Which of the following is the most likely etiology of this patient's change in clinical status? A, malignant hyperthermia, B, neuroleptic malignant syndrome, C, serotonin syndrome, D, anaphylaxis, and E, iatrogenic bladder injury. The answer is A, malignant hyperthermia. 65. A 42-year-old man has had a rocky course for the 3 days following a bowel resection for intestinal perforation due to inflammatory bowel disease. His CVP had been 12 to 14 but is now 6 in the face of diminished blood pressure and oliguria. Which of the following is the most likely etiology of his hypotension? A, pulmonary embolism, B, hypervolemia, C, positive pressure ventilation, D, pneumothorax, and E, gram-negative sepsis. The answer is E, gram-negative sepsis. 66. Acute renal failure occurs following aortic angiography in a 72-year-old man. His weight has been rising, his lungs show rales at both bases, and he is dyspneic. His fractional excretion of sodium is greater than 1. He has eosinophilia on his peripheral smear, an elevated erythrocyte sedimentation rate, and proteinuria with microscopic hematuria. Which of the following is the most likely cause of his renal failure? A, hypovolemia, B, renal artery cholesterol embolism, C, acute tubular necrosis, D, cardiogenic shock, and E, aortic dissection. The answer is B, renal artery cholesterol embolism. 67. A 55-year-old woman has been hospitalized because of recurrent pancreatitis, ARDS, prolonged ileus, and the need for parenteral nutrition. She demonstrates weakness, lassitude, orthostatic hypotension, nausea, and fever. Which of the following abnormalities is most likely to explain those symptoms? A, hypothermia, B, hypokalemia, C, hyperglycemia, D, hyponatremia, and E, hypervolemia. The answer is D, hyponatremia. 68. A 19-year-old man sustained severe lower extremity trauma including a femur fracture and a crush injury to his foot. He requires vascular reconstruction of the popliteal artery. On the day after surgery, he becomes dyspneic and hypoxemic and requires intubation and mechanical ventilation. Which of the following is the most likely etiology of of his decompensation? A. Aspiration, B. atelectasis, C. Fat embolism syndrome, D. Fluid overload, and E. Pneumonia. The answer is C. Fat embolism syndrome. 69. A 33-year-old woman is brought to the emergency room from the scene of a severe motor vehicle accident. She is combative, confused, uncooperative, and appears dusky and dyspneic. Which of the following is the most appropriate management of her airway? A. Nasogastric tube placement, B. Tube thoracostomy placement, C. Fiber optic laryngoscopy, D. Endotracheal intubation, and E. Cricothyroidotomy. And the answer is D. Endotracheal intubation. 70. Following a boating injury in an industrial use river, a patient begins to display fever, tachycardia, and a rapidly expanding area of erythema, blistering, and drainage from a flank wound. An X-ray shows gas in the soft tissues. Which of the following measures is most appropriate? A. Administration of an antifungal agent. B. Administration of antitoxin. C. White debridement. D. Administration of hyperbaric oxygen. And E. Early closure of tissue defects. The answer is C. White debridement. 71. Following pelvic gynecologic surgery, a 34-year-old woman becomes dyspneic. Her peripheral arterial oxygen saturation falls from 94 to 81%, and her measured oxygen is 52 on a 100% non-rebreather mask. She is hemodynamically stable. A CT angiogram is consistent with a right lower lobe pulmonary embolus. Which of the following is the next step in her management? A. Systemic anticoagulation with heparin infusion. B. Systemic anticoagulation with warfarin. C. Placement of an inferior vena cava filter. D. Thrombolytic therapy. And E. Open pulmonary embolectomy. The answer is A. Systemic anticoagulation with heparin infusion.